Hello everyone, welcome to listen to our panel about children, parent, teachers, understand and encourage. We think positive today. ADHD Europe's goal is to provide reliable information and resources for help people move forward with ADHD. Although the month of October is designed as an awareness month, and that's why we are here to talk about these things. Learning and sharing information about ADHD is beneficial all year long. We encourage you ADHD communities to help all people move forward by continuing to share information, understanding, and support. This year, we do it by spreading information. The theme of this year is awareness is the key. And today, I have with us Karen from USA, Arya from Austria, it was, Sophia from Greece, and myself, I'm from Finland. So now I give you the virtual microphone, Karen, and you can introduce yourself. You're welcome.
I'm very happy to be here. I'm very happy to talk with you today. I'm Karen Sampson Hoffman. I am the public policy liaison for CHAD. I am also our director of marketing and our representative to the ADHD Awareness Coalition, which is a group of 3 ADHD organizations. We sponsor a conference and we also sponsor ADHD awareness in the United States. And so just a little bit about my background. I joined CHAD 17 years ago, so I have been a member of the ADHD community since then. And not long after I joined CHAD, I had some young family members who were diagnosed with ADHD. And so my personal experience into ADHD is as an aunt who is supporting her siblings in raising their children. And what else can I tell you?
Thank you. Let's jump to Sophia.
Hello, everyone. Very happy to be here. Nice to be here with all these ladies. And for Awareness Month, I come from Greece, ADHD Hellas. I'm the president for the past 3 years. It's an organization that was established in 2009 by parents of children with ADHD, mental health professionals, educators, and other specialized experts. We have been raising awareness and providing information on issues concerning children, adolescents, and adults with ADHD, while guiding and supporting individuals with ADHD throughout Greece. We are the only one organization here in Greece with ADHD, and we support families in every possible way we can. So the Pan-Hellenic Association seeks access to diagnosis and treatment because we believe that's the right of all citizens. As far as my personal background, I am a psychologist for the past 24 years, and I work as a psychologist in the private preliminary and kindergarten schools. I used to work with children with special needs, and when my son, before 20 years ago, was born, he gave me the incentive to handle him because he was diagnosed at the age of 7 with ADHD, and understand what ADHD is all about with learning difficulties. So we are a family with ADHD because his father also is an ADHD adult because he was diagnosed after our son. So my interest in neurodiversity is personal and also professional. So that's why I'm here. Thank you.
Thank you. And Arya.
Yes, thank you very much. So my name is Arya Krauchenberg and I represent the European Parents Association. I'm a little bit the odd one out here because I'm not specialized in ADHD, nor is our organization. Our organization is an umbrella association for more than 30 parents associations or federations of parents associations in more than 20 countries in Europe. And we deal with education in general. So we represent all parents, not only parents of children with ADHD, but all parents that are involved in the education of their children. We advocate for this parental involvement in all matters that concern their children. So, of course, we also take care a lot, and especially now after the pandemic, on mental health issues that have increased enormously. But we also deal with digital awareness. We also deal with other issues that parents in education are concerned with. Our main objectives are to connect our members. As I said, we have more than 30 members. We do that twice a year in a general assembly and a conference to exchange views and challenges, but also find solutions together. And then we represent parents at the European level towards the Commission, the European Parliament, but also the Council of Europe. We do that, as I said, for all parents. And I'm happy to be here today and to share a little bit our view on how this can work better.
Thank you very much. I'm very glad that you are here because a lot of questions that we get are coming from parents and teachers. And I think everyone who sits around this table can say that that's one of our biggest goal to answer for the teachers and parents how to go further with these kids. And I usually say what is good for ADHD children is good for everybody. So it doesn't mean that we are only talking ADHD today. We are talking about parenting and the kids also in school. But does everyone need a diagnosis? What do you think about that? This is the question we quite often get, and specialist professionals ask, does everybody need a diagnosis? What do you think? Karen, how is it, for example, in USA?
Well, the question diagnosis is always a tough one because sometimes the diagnosis is not always necessary when we're looking at the more mild symptoms. However, in schools, diagnosis is very helpful. We have a law called IDEA, and underneath that law, students with disabilities can receive services in school. And so it is helpful to be able to share that information with the school. It's not necessary, but it is helpful. When it comes to looking for treatment and looking for additional support, one of the things when we're talking about support is ADHD is recognized as a disability under federal law, both under our education law and under our disability law. So having that diagnosis can put certain protections and assistance in place. So it's a very useful tool in order to get that help that students, young adults need in various situations.
Okay, thank you. Is there someone else who wants to say anything of this?
Yeah, just a small comment. I think that diagnosis maybe is important when ADHD interferes with well-being, the general well-being of the family or of the person. So, but not all cases here in Greece require medical intervention or this kind of treatment. So because the person can cope effectively, maybe. So I agree with Karen, but sometimes we have to see whether it's the well-being of the family of the person is interfering.
In Finland, I can say that we don't need a diagnosis in school, but if you need medication, you need a diagnosis, and this is something that when we have a lack of money, so quite often headmasters, teachers goes behind that the kid don't have the diagnosis and they are not getting the support, and that's not okay. But in school we don't need diagnosis in Finland to get help. But Arja, you had something also on this point.
Well, being a European organization, it's a bit difficult to take a standpoint on this because legislation is so very different from one country to the next. Already in education, you know that education is a national competency, so every country has its own educational laws, and so very much also for the sector of health. So yes, in some countries, as Karen said, if you have a diagnosis, that gives you access to services and to support. In other countries, that's not needed, as you just mentioned in Finland. So it depends a lot on the context where you are, whether this is helpful or necessary even, or whether it's rather not. I would say that on a general basis, it can be problematic because it might also stigmatize children. Yeah, and having a diagnosis, I think what Sophia just said, take into account the well-being of children is very important, and sometimes this kind of stigmatization can have a bigger influence, negative influence on the child's well-being than not having a diagnosis and just being treated carefully in any case in the context of school. So I think it depends a lot on the context, and there's no one size fits all.
Then I have a question from teachers. This is quite often I hear this also from kindergarten. Are these specific criteria or observation I should note to differentiate children with ADHD from those who are typically developing? And this is something I have been working earlier with the kindergartens, and the teachers quite often think this child has ADHD. But could you support the teachers in kindergarten or in school that this is normal and this is not normal? What do you usually tell to them? Is there someone who wants to? Karen?
Yeah.
Sure. In the United States, we have been addressing ADHD in preschool and young children, and we don't encourage a evaluation until about the age of 4 or 5. So it is in kindergarten and it is in our first grade that a child may receive a diagnosis at that point. We have several tools. They appear to be surveys, and they are filled out by teachers. And what the teacher is looking for is this child more active than other children? Is this child struggling with things that should be age appropriate? Is this child blurting things out, or is this child daydreaming? And you are comparing not simply to her classmates, you are comparing the child to what is age appropriate for this time. And so we also, in the evaluation process, the doctor, the ADHD specialist, is going to ask for a family history and see if this is also present in the family. These are things that we're looking at because we want to begin treatment as soon as possible, but we don't want to begin treatment when it's not needed. So you understand we've got that little bit of tension. We want to be right there with our child, make sure she has the resources, make sure if we need to bring education law into play, or is this a child who is just on her own time track? So kindergarten, first grade, we wait for evaluations because at that point we can see how is she behaving in school, how is she in various situations? Because as you know, when you're looking for ADHD symptoms, you're not looking just in one location, such as the classroom. You're looking across locations in sports, in social clubs with family members.
Yeah, I agree. I totally agree. But when we talk about early symptoms, sometimes it's very crucial to, write down, to have the opinion of the teachers of the kindergartens before the evaluation at the age of 6 or 7. Here in Greece, we have evaluations about 7 years old. But we can, foresee some symptoms like phonological awareness, speech problems, memory or visual perception problems that indicate preliminary ADHD symptoms, and we can keep them in mind. Has proven that the intervention afterwards is more effective when we react early and we foresee and treat speech problems or memory problems in early stages, and then we don't have, more complicated factors when we enter the preliminary school. So it's helpful to, keep in mind the early intervention about these problems I previously was referring to, so that we can avoid academic failure or social network problems or anything else like that.
Okay. Then I ask, have you, Arya, I was thinking that you have perhaps a picture about how well equipped are our education system for children with special needs. If you look for Europe, I know that there's differences, but you have you said over 30 members, so you know a little bit how it is if you look for the Southern Europe, Eastern Europe, North. What is your feeling about with the education systems for children with special needs?
Yes, well, thank you. Thank you for the question. What we observed during the past maybe 20 years was a big shift towards inclusion. So in the years before that, very often children who did not perform as foreseen in the system, let's put it that way, or children with obvious disabilities were very often separated and segregated into special schools. Now, there has been a big movement from parents of these kind of children to not do that, to leave their children in mainstream education. This has been partly successful, let's put it that way, because inclusion in the mainstream class for children with disabilities, and I mean, that goes for actually every kind of disability, not only ADHD, but also physical, other cognitive disabilities, and so on. It needs a support system in the school. You cannot expect the regular mainstream teacher or teachers, because in secondary school you usually have several teachers, to handle these issues in addition to their normal teaching. Yeah. Now, these support systems are very different, or at a very different stage in different countries in Europe. And I would say, I mean, this is a bit generalizing, and I don't like to generalize normally, but you can say that these systems are better in place in the northern countries than they are further south. Yeah. On a very general basis. It also has to do with investment, of course, with financial and human resources, but not only, it's also a mind shift. And so this idea of inclusion is a wonderful idea, but it only works well for all children, not only for the children with disability, but also for the children, kind of the regular children. Yeah, I don't like to call them normal children, because I mean, we're all individuals, and what is normal and who sets the norm? Yeah, that brings us into quite a different discussion. But let's put them, the mainstream movement in the class also profits from a good support to children with a disability. So if the systems are well in place, then this can work. if they are not, and at the moment we are not only facing a teacher shortage across Europe, not only across Europe, I mean, even when I talk to colleagues in Latin America or in Asia, they also have a problem with teachers. Yeah. And we talk about a shortage of staff. Then, of course, we understand that the support system, that the teaching system, the education system as a whole is being challenged. If in addition we do inclusion, then we run a big risk that these children will again fall through because nobody is there to really take well care of them. And I think that is a pity, because the idea of inclusion is great, but the systems have to be there in order to really take good care of these children in the mainstream class. I don't say that in the worst case, it's better to have them in a separated school where people really take care of them. I don't think that's the ideal solution, but if there's no good support in the mainstream school, they might be better off actually in a special school, yeah, because then there we have like one teacher for 7 children, whereas otherwise you might have not even a teacher for 25, yeah, and that's not a solution for children that have special needs. Absolutely not, unfortunately.
Thank you. My experience is that the inclusion, when it started, so the headmasters use that to spare money, and they kick out all the support persons from the school, and that's very pity, because now the inclusion is not happening, and we can see when you go from one stage to another, so our special child, they drop out. So the school drops out are really big numbers. And when we look in Finland, how many children didn't manage to go through the school. So we have the biggest figure ever here. And that's very pity. Okay.
Well, can I make a comment here? Because
yes,
it's very
please.
crucial.
Yes, please.
Here in Greece, we have something like a law, a parallel supporter for the children with ADHD and autism. And until 2 years back, there was one parallel supporter in the classroom for each child. But now, due to lack of economics and all of that, we have one parallel supporter for 3 children, and that's very difficult, because when it is one-to-one, then the child, flourished in the typical classroom. That was inclusion for us here, not to take them to separate classes, but into the typical classroom with their personal carer, which we call parallel supporter. It was a very nice support and help for the children and for the parents also, because they do not know what the child does in the classroom exactly.
Then I think it's also, I think it's problem when I look when our teachers go to school, and they are very little, they can get information of special children. And then if I look, I have been jumping in as a teacher now and then, and the parents are really difficult today. They want to that we take in as in school, take care of the children. So you should always remember that you take care of the whole family. And there can be ADHD also at home, but it's not diagnosis. I would like to ask you, Karen, do you have the same problem in USA, what we are talking here now?
We do struggle with making sure there is enough funding to provide those services. We have some school districts that are terrific in providing those services. Our system is broken up. Again, you're familiar, we have 50 states, we have 50 sets of different education laws, but generally schools are doing their best, but we always struggle with funding. Unfortunately, we also come across the human factor in that some school administrators, you mentioned headmasters, we have our principals, our superintendents. they don't have a complete understanding of what is ADHD, what is actually required. And so sometimes we see education plans that are drawn up that put all of the work on the child. The child will do this, the child will do that, rather than understanding this is a student who needs adult support, who needs redirection, and that some of the misbehaviors that arise are part of ADHD. They are frustration level. They are the desire to no longer get in trouble in the classroom. And one of the things you mentioned that some students are removed from schools. We have the desire in the law to keep students in their classrooms, but again, with the lack of support, and schools receive a certain amount of funding for special education services. If they have students above that level of funding, all of the financial support lands on the school district. Some school districts, again, are terrific. They're right there. They've got the funding. They can do this. Other school districts, they don't have as much funding. They don't have as much financial support. And so there will be some pushback to limit the number of students needing that educational support. And our students, because ADHD is an invisible disability, are often the first ones that they attempt to minimally support because of that. Chad, many years ago, we fought to have ADHD included underneath education law, and it's recognized there under the phrase otherwise health impaired, so that our students will be recognized as needing needing academic support and classroom support. We very seldom will have a paraeducator, such as you were saying, working with an individual child, but we do have other support systems that we can educate that child, meet her needs, and have things going very well. It's, as you know, classroom and parent conversation is critical to make sure that the student has what she needs. And like I said, Chad, we have been advocating for further inclusion of ADHD.
I'm not quite sure how to help you with that.
Pardon me. Further inclusion with ADHD being recognized underneath the law, how many of our students actually have ADHD, and gearing the laws to specifically say, this is what our students need, this is what we can provide. And that is one of the things Chad has been pushing for in the last few years. And as I said, right now, ADHD falls under the heading otherwise health impaired, which includes several other health conditions and disabilities.
Thank you. This is it's nice to hear that we are struggling with the same problems, but same time I can see also that teachers are looking for other job because it's too much, and I think if we can use more information to share and understanding, so it's important. And then I think it's also important always to look the whole family. But how could we support the teachers in their work? What are the good, what do you think about good methods, more information? What would you do?
Well, Chad has a program we call Teacher to Teacher, and we are expanding that program. The idea is we have classroom teachers who we have worked with, have been trained in ADHD, presenting this in order to teach other teachers classroom management styles, things that are helpful not just for the child who has ADHD, the student with ADHD, but the entire classroom. We are also looking to, Chad also provides individual support in the, well, let me rephrase that. Chad provides a lot of information to teachers, and we help teachers understand what is going on. We have a professional membership that is targeted towards teachers so we can get them that information specifically. We have, during our upcoming annual conference, the annual International Conference on ADHD, we have certain training classes, certain training tracks for teachers to get them that information. But our biggest thing, again, is we are advocating to have the laws be current with the needs of students with ADHD and help educators, superintendents, principals really understand what is occurring, that this is not, while it is expressed behaviorally, this is not a behavioral condition. This is a brain-based condition. that is affecting so many parts of a student's life. And so getting that education, helping them understand, we connect parents to advocates that will work with them and the school to put in place those educational plans to meet that student's needs. We're doing our best. We have multiple patchwork of education law that we do navigate in assisting our students.
Sophia.
Here in Greece, for the past few years, we have a lot of schools from all over Greece that are calling us and addressed to us to use our knowledge about how to treat ADHD children, students in classroom, because there's a lot of inadequacy, as we said before. So to support teachers in working with children with ADHD, we keep an open communication about the children's needs, specifically ADHD needs, challenges or strengths, or even, talents that maybe ADHDers have. We also share successful strategies that work at home, at school, like behavior management routines or strategies. We have professionals that provide such knowledge to them. We try to be proactive because every school program must be tailored to the students with ADHD needs. So we provide some consistent updates about changes, about treatment, about behavior, about making goals, setting goals about their needs and their changes in the classroom. So we are trying to help them create a supportive learning environment, positive teaching environment tailored to the child's needs. I think I cannot hear you.
Oh, sorry.
Yeah.
Arya, I'm looking for you because you know the teachers. So it's not only ADHD. What support is needed that teachers have the peace to teach our children and stay there, because we have also the lack of teachers. Teachers are going to find some other work because it's so stressing. So what would you, as a EPA leader, say to these teachers?
Well, we cooperate with different teacher organizations, with the teacher associations, but also with the teacher unions. And when we talk to teachers, one of the general complaints, I would say, is always that they have too much bureaucracy on their hands, that they cannot get to their real task, which is teaching, but that they spend tons of time in filling in surveys, putting up lists, checking boxes, and this takes a lot of time and a lot of energy. And people have the impression that everything that is not working well in society, people are asking the schools to fix that, and that won't work. Education is definitely one of the pillars of our societies, and of course, the way we educate young people will have an influence on the society that we will have in the future, definitely. But we cannot put all those tasks on teachers. Teachers today, if you look at what is asked from them, they are not only asked to teach, chemistry or geography or mathematics, but they should also do financial literacy, health literacy, digital literacy, super important at the moment, without proper training. Which means that in their studies at university or teachers' colleges or wherever they got their education and training, they were not taught how to integrate all these points into their teaching. And now we're also asking inclusion without giving them the right tools. So I think we need to start to think, what do we expect from teachers? And then give them the proper training so that they can actually execute and live up to these expectations. If you are a teacher who has trained in, I don't know, mathematics and physics, for instance, then you would not necessarily have any clue about mental health. You would not have necessarily any clue about children with disability. You would not know about financial literacy or digital literacy. I mean, as a mathematics teacher, probably you would be familiar with things like algorithm and so on. But I mean, if you have done your studies 40 years ago, you would not be familiar with digital teaching, right? So what we need to do is integrate these things into teachers' training courses. In some countries, this is already happening. For example, in my home country in Austria, teachers now have a kind of module on children with disabilities. And that module is great, but it has led to the retreat of support personnel from the schools. Because as you mentioned, they save money, right? They take out the support personnel saying, well, now the teacher anyway has these capacities, and then they will deal with that. Yeah, but it's still just one person with two hands, right? And one mouth, and they cannot deal with 25 children, of which 5 children have special needs at the same time. It's just not, I mean, you can't clone yourself, right? So I think we need to understand what we expect, how we can best train people to do that, and then nonetheless, they will need support in class if we want this inclusion to work. It's not going only about training people, it's also about physical support, meaning that there's another person there and not any kind of digital device that helps. Yeah? And if we don't get this done, I'm not sure that we can make this work. But training is definitely a very important point for all the things that we expect.
You mentioned education of teachers and the training. In our education, our college, university level education for teachers, they don't necessarily receive a longer or thorough amount of education on special education, on disabilities, unless they are planning to become a special educator. And so this is one of the things that we have been discussing for quite a long time, the need to update our education system for teachers, that during that critical period of learning to teach, having the exposure to additional students, that they have that when they come into the classroom. We're finding that a lot of our younger teachers have a better education on special needs, on ADHD, on other conditions. Some of our older teachers are still learning. They are in process with that. But it is, again, it's very important that we educate our educators on ADHD, on special needs in our classrooms, and how to put that in place. It is an ongoing conversation, but this is one of the things that we are looking forward to improving in the future.
Thank you. How are families with children that have special needs, such as ADHD, revealing the weakness of our societies, our educational systems, or our non-parental families, and show on areas retracting as social education, political change are needed to be truly inclusive for us? What do you think? What must we do?
Well, if I understood well, we are talking about families and parents here and ADHD. Well, ADHD is a family disorder, because when a child is diagnosed with ADHD, maybe we can, seek amongst us whether someone else is under this disorder. And the ADHD also is a family disorder because it can affect all aspects of the child's life. it affects not only the child, but also the siblings, the parents. It causes disruptions in family. It causes marital functioning. When they do not behave themselves, it causes a lot of confusion and consequences in the communication. And all these are, has been associated with increased healthcare costs for patients. And we have to take this into account, because here in Greece, the family bleeds with the healthcare cost about treating ADHD, because the healthcare system does provide a small amount about therapies, occupational therapies, speech therapies, and all these that are needed for the child to progress. So the families are, having a hard time following this treatment plan. And in some aspects, in some circumstances, the family is acting out of the treatment because they do not have money, and the child is left unattended without help, and the school cannot, as we said before, cannot do a lot of things because of the inadequate circumstances sometimes. So we are proposing that the support for the families, not only the economical, but also the emotional support, is very crucial, because they think at first it's something like the emotion of that you lost something when you get a diagnosis, and the family is all confused, and there's no support after the diagnosis. Sometimes they do not know, they do not have any psychoeducation planning about what ADHD is, and they're so confused, and they're misled for a long time until they find the proper behavioral or treatment plan for the better of their family and their child. I could talk a lot for hours about that. I will leave all the ladies talk their opinion, but we have a lot of problems here about treating the families with ADHD in all aspects and social aspects, because the families do not want, the parents do not want to be diagnosed sometimes because they're stigmatized. We have a lot of problems in the army. When a child with ADHD or ADD is diagnosed, then we have problems entering the army for the 2 years that we do here. And it is they have to do that here, the boys in Greece. So they are telling them that you cannot follow this program, cannot enter the army. So they feel that they are out of the system, out of the school, out of the system, out of the university. So the families need the most support ever.
Chad has a system of family support groups across the country, and many of our support groups also meet online. And to do much of what you're talking about, to have parents and family members be able to talk with one another, this worked for my child, this did not. Here is a local provider that you might want to check with. I've worked with the school before, let me go with you and help you work things out with the school. So that family support is crucial, because very often parents feel all alone in this, and they are looking for someone who has been there and who can say, okay, I know the way out, I'm going to help you. And so having that individual family support, that is very crucial. And when we're talking about treatment for children, we look at it from a multimodal point of view, behavioral management, and for our youngest children, that is family training on how to help that child. And then we go on further with behavioral management skills. First, the parents are helping to manage the child's behavior, and then the child is taught to manage her own. We do employ medication children. That is a decision that with the doctor. We present information, but we have no stance on to do it or not to do it. That is a very personal decision for a family. But as you said, when a child has ADHD, the whole family has ADHD, especially since we know that it is a genetic condition. So it's very, very likely that at least one parent also has ADHD. So meeting the family where they are and having that well-developed support system. Chad's been around for a very long time, and we began with the premise that parents need support and they need assistance in navigating various systems.
If I can come in on that, I would like to say that actually all parents need support. This is the standpoint of the European Parents Association, because parenting is actually one of the most difficult tasks in the world, but nobody ever gives you any training for that. I mean, you would never let any electrician touch any of your electrical equipment without being sure that this person has had proper training, right? You would not let ever anybody do anything to your water pipes if you are not sure that this person really knows how to go about this. But then we expect people to have children and to raise children, which is really a difficult task, without giving them any training or without them having any clue. Yeah. We still suppose that this works in the family, so that they have family support from, I don't know, grandmothers, siblings, uncles, aunts, and so on, which we know in these days is no longer the case, because people in the great majority do not live with their family together any longer. Yeah, that was true in the 19th century, maybe, but ever since the mid 20th century and in the 21st, even less. Yeah, so how do you know how to parent? And then even more so if your child is not developing as the books, or nowadays it's probably an app that young people refer to, yeah, says. What do you do? Yeah? How do you find support? And I think what Karen just mentioned, I think this is very Anglo-Saxon, these support groups, and you organize yourself and you have self-help groups. That's a lot less in Europe, and even less in the southern parts of Europe, because the system, the society just doesn't function in that way. Yeah, it's still a lot about the family and maybe even the extended family. I don't want to say clans, but yeah, a little bit. Yeah, but they are very often overwhelmed with these questions as well, apart from having sometimes very ambiguous ideas about disabilities still. Yeah, you do not bring a child that has a disability into public. It's something like it's private. You more or less hide it somewhere. Yeah, that's what we also mentioned before, the stigmatization. People don't want the diagnosis because then they feel really excluded. And if things like not being able to do your military service or acceding to any other normal functions, then people don't want that. They want their children to be treated in the same way than everybody else. And I think that's a very understandable desire from the parents' side. On the other hand, we have to make it clear to parents that sometimes, in some cases, they need this support and they will have to ask for it, because unfortunately, the system by itself does not automatically provide things. And that is a problem that we are confronted with everywhere. And when I say, but all parents need support, and we need to look at children from early age on, we talked about how to recognize things in kindergarten. I think it's very important that also our kindergarten teachers have a certain education and training to be able to identify at least possible symptoms of all sorts of disabilities. Because at that age, as children don't read and write yet and don't do calculations, very often even disabilities like being hard of hearing are not detected immediately. Yeah, because children develop all sorts of functions of how to go about this not being able to hear well. Yeah, or not being able to see well, or whatever other disability that there might be. Yeah. So it's very important that the personnel is well trained, and that also at certain points, I think experts come into kindergarten and into the first years of school to help them to identify when they have detected certain symptoms or certain things that they are not sure about, that they can call and that somebody comes to help them do this. Not a diagnosis, it's not a medical diagnosis at that point, but to really make sure that, okay, this is a normal development problem, or this is just something that we really need to take care of. I think that these kind of things need to be in place. And then also to take the parents on board and to say, well, the kindergarten teacher has identified XYZ. We have had an expert come in that has confirmed that. And now we're going to help you and guide you through the next steps that need to be taken in order to make sure that your child still can go into a mainstream school and has a successful academic career and can later on lead a fulfilled life. That's what we want for all children. We want everybody to live up to their full and unique potential and to lead a fulfilled life. That's our goal. Yeah. And I think with the adequate support, we can most probably achieve that for all children.
Thank you. You answered my last questions. What more and what less? And this is very good to make a stop for our panel, because I think you really answered my last question, because I think also it's very important to see the whole family and give the support and give the right information for the professionals, that they can be on their job and the families get the right information. A big thank you for this discussion, and I hope that our listeners can get some small ideas from this, and now at least you can get more information when you go to our sites, and here we are for you. Thank you.
Thank you very much for the invitation, and thank you for the colleagues to be here and to provide all this information also from the specialized organizations. We always look forward to cooperate with you and to redirect our people to you if possible. Thank you.
Thank you.
Thank you very much. It was nice to be here with you, and it's nice to hear our voices, everybody, to hear our voices from our patients' option and families' option.
Yes, it's been a wonderful discussion, and we're very happy to be part of this. And seeing that ADHD awareness is now a worldwide effort, and that is something that we are very pleased with, and very pleased to be working with you today.
Okay, bye.
Bye.
Bye, thank you.